welcome back to another episode of the Soapbox, your patient education station. I thought that in light of all of the ankle tape jobs I've been posting, I should do a little PowerPoint on ankle sprains and just explain the anatomy and basic rehab from them to use if you are currently recovering from a sprain or if you're a dance teacher and not sure what to do with a student who has a sprain. So I've outlined a few guidelines here for you. So, ligaments of the ankle, I just wanted to be clear that a lot of people actually get this wrong. There is a difference between a ligament and a tendon, and also the difference between a sprain and a strain. So, ligament versus tendon, a ligament is like a seatbelt, and it seatbelts bone to bone. So it's kind of like a thick little shoelace, and it's going to connect bone to bone. Whereas a tendon, if you ever have the opportunity to work with, like in an anatomy lab with a human cadaver, you'll see like kind of the meaty part of the muscle, and then coming off the muscle, there's kind of like a stringier or a thinner kind of shoelace. That would be a tendon because it tends to connect muscle to bone. Okay, so just know that distinction, that when we're talking about a ligament, it's a bone-to-bone type of connective tissue, whereas a tendon is attaching muscle to bone. Sprain versus strain. So there is a difference. A sprain with a P is when we're referring to ligaments. So we've stretched, torn, or maybe ruptured any ligaments in the body. It's referred to as a sprain. A strain, think it has a T for tendon, so this has to do with a muscle injury, okay? So if we strain a muscle, we've either like torn it or maybe stretched it, that's referred to as a strain, okay? So just know the difference between a ligament, tendon, and a sprain versus strain. Okay, muscles of the foot. So we're not going to go over all these, but I just wanted to put up this PowerPoint here just to kind of show that there's more than one muscle in your foot. It's not just one big chunk. So as you can see, there's a lot of little intricate muscles. There's also several layers of muscles in the foot. But note that some of the muscles that start in the calf, they actually cross down and wrap, as you can see, kind of behind this outside ankle bone here, okay? So there's some muscles that come down and they wrap underneath. We're going to chat about those in a minute, but just a quick little bony anatomy review. So we have the ankle here. We have our inside shin bone called our tibia, our outside shin bone called our fibula, and what I've highlighted there is the end of the fibula or lateral malleolus, okay? So that's just the fancy name for the end of that fibula bone. That's the outside ankle bone that we can feel. And on the inside ankle bone that we can feel is actually our tibia, and this bump in particular is called our medial malleolus, okay? So, moving right along, again, this is just a quick little view of that medial malleolus, okay? That we have here of that tibia bone, and again, just notice there's inside calf muscles, and the tendons here kind of wrap around the inside of that medial malleolus or inside ankle bone. Peroneus longus and brevis. So I wanted to highlight these two muscles on the side of our leg or the side of our fibula, our peroneal muscles, because they're usually stretched or strained when we have an outside ankle sprain. And as much as inside ankle sprains happen, we're going to speak more to an outside ankle sprain today. So basically, we have our ankle here. The peroneal muscles come down along the fibula and they kind of wrap underneath. There's peroneus longus, it just happens to be longer, and we have its little brother, brevis, tucked underneath. And just notice that they're starting again along that fibula bone, and they connect to different points on the outside of the foot. So if we roll our ankle to the outside, which is an outside ankle sprain, just note that because of where they pass, they're going to get a little strained as well in a sprain. So those are the ones that we want to kind of start to strengthen in an outside ankle sprain. This is just like another image. If we were to kind of palpate or feel on somebody, again, they're the muscles right on the side of the shin bone. Okay, our talocrural joint, it's just a fancy name for your ankle joint, okay? So tibia bone, fibula bone, they come together and they sit on this main ankle bone called our talus. And so collectively, they are called our talocrural joint, which is, again, just the technical name for our ankle joint. So, two types of sprains. Outside ankle sprain, which is on your left here, we're going to have a look at. And just notice that there's little kind of red strands, I'm going to highlight 3 of them, coming off the lateral malleolus, all right? So when we're talking about an outside ankle sprain, again, it would be also known as an inversion sprain. When our foot is rolling this way, so inside border of the foot comes up, and we roll and stretch all the tissue on the outside of the ankle. That's kind of the most common one that I see. And so there's 3 little seat belts here that kind of secure that lateral malleolus in place. And so when we roll it, we can stretch or tear or rupture 1, 2, or 3 of those ligaments. And again, there's different degrees of severity of sprains, but just know that if you have an outside ankle sprain, you've likely done some damage or stretched 1, 2, or 3 of those little ligaments. Now, the one I want to draw attention to is called our anterior tibiofibular ligament. Yes, very complicated name, but basically it sits a bit higher. Okay, and so this one, what's special about this one is it connects tibia and the fibula, okay? Tibiofibular ligament. That's our AITFL, okay? So it sits a bit higher, so if we roll it so much that we actually do some damage to this one here or stretch that one, that's what we call a high ankle sprain, okay? These kind of a pain, no pun intended, to come back from. They take a little longer, it's more complex, because the purpose of this seatbelt is to prevent these 2 bones from splaying a lot when we weight bear on the talus, okay? They're meant to a little bit, have a little bit of give, but again, with that seatbelt there, not too much. If it's stretched or it's ruptured, again, we're going to get too much splaying as we go to load that ankle joint, and so that's why it's really important to modify or limit weight bearing, especially with the high ankle sprain, because of the unique placement of it, okay? And they are more complex to deal with and they can take longer. So just know that when somebody says a high ankle sprain, they've kind of affected that higher ligament as well. And if we look at our inside ankle sprain or our eversion sprain, this would be the other way. So the outside border of the foot comes up and we actually roll or stretch kind of the inside tissues. There's 4 little seat belts that come off this medial malleolus. We refer to them collectively as the deltoid ligament, okay? Not as common, but it does happen. And so if those are stretched, that would be an inside or eversion sprain. Okay, stages of healing. So I wanted to walk through just the basic stages of healing. This is kind of for any tissue, soft tissue, but use these guidelines, take them with a grain of salt, because as we'll talk about in a second here, it depends on the history, the ankle we're dealing with, the person we're dealing with, their history, as to how long that tissue is going to heal. But just know you cannot go off of pain as a guide for an ankle sprain, because the pain will go away relatively quickly, like usually within the first 1 to 2 weeks. That does not mean that the tissue or the integrity of the tissue is healed. So just be mindful of that. So the first stage, there's 3 stages, is the inflammatory stage. So this is our early, like fresh ankle sprain. This is within 7 to 10 days. And we get this inflammatory soup. Okay, so all that swelling, that's the body sending these like first responders, kind of initial healing helpers to the scene, okay? And we want that healing or that swelling to happen because that's the first stages of healing. So that's what happens right away, usually within the first week. Then we have our proliferative stage, which is the middle stage. This is about 10 to 21 days or 3 weeks post-injury. This is our reparative stage. So think, all right, first responders were on scene initially. They took us to the hospital for maybe initial surgery or to like put the first step of Band-Aids on or tensor it up or a cast, okay? So this is like our body is starting to lay down some type of connective tissue or fibrous tissue, but it's weak. It's just like kind of again to help those initial stages, but it's not super strong. So this is just starting to heal. And then the remodeling stage, so later, like 3 weeks up to like even a year, depending on the type of injury, we have what's called the SAID principle coming into play, and we'll chat about that in a second. But basically, this is where that kind of weak tissue is replaced by a stronger tissue, our type 1 collagen, and it's thicker, and this is the stuff that we want in and around our injured area in order to be able to safely return to play. So that's the tissue we're trying to strive for. But if we re-roll our ankle, say at the 2-week mark, don't you know we're going back to square one, okay? Back to that first responder stage of healing. So it's really important we respect these stages of healing, and there are certain things we need to do at each stage in order to promote progress in these healing stages. So inflammatory stage is a fresh sprain. This is 7 to 10 days post-ankle sprain. Our inflammatory soup, first responders in the body coming to the scene to help start the process. I use the acronym PRICE. So P, we want to protect it, most importantly at this stage, either with tape, brace, very supportive footwear, okay? We want to rest it, but relative rest. We don't just want to sit for a week and not move it at all. It'll kind of stiffen up. We actually want to help kind of flush some of that swelling and inflammation out of there. So we like to start with gentle range of motion. We'll talk about exercises in a second, and limit the weight bearing, okay? My rule of thumb is if you cannot walk without pain or without a limp, you need something to help you walk initially, or limit your weight bearing for those first couple days. Ice. Little bit of controversy in the research as to whether or not to ice. So it depends why. So I always say if you're icing for the purposes of pain, you want to just kind of numb the area, ice for 5 minutes, again, for that numbing effect. We're not trying to ice to get rid of any inflammation, okay? We want to control it a little bit, but that inflammatory soup, that swelling, that's actually helpful. Like, that's the first stage of healing, so we want that to happen. So what the research is showing is like, okay, we shouldn't be icing because that's what we want to do. We don't want to stop inflammation. We'd like to control it a little bit, but it still needs to happen, okay? But if you're icing for the purposes of pain, go for it, max 5 minutes on and off, like throughout the hour. But again, for the purposes of an analgesic effect. We want to compress, so tape is useful, and also the use of a tensor, kind of on and off with compression, and elevating. So we can like have our ankles up, do some ankle circles in the air, again, encouraging gentle range of motion in that elevated position. Ideas for exercises. So at this stage, we want to protect, promote gentle range of motion, and limit weight bearing. So I'm thinking ankle circles, you can do some name writing with that ankle, balance on a flat foot, eyes open to start, and then I challenge you eyes closed, again on a flat foot. Ankle pumps are just pointing and flexing, and then again, keep it moving, but in that maybe a limited weight bearing position to start. Dance class. So these kids can do wall bar. If you're familiar with wall bar, they can certainly do all their core work. It's non-weight bearing. Bar work on their good leg, okay? We just injured an ankle, okay? We still have all the other body parts we can still continue with strengthening and retraining of. Other joint strengthening, like the hips in particular, great. So any deep rotator work, again, non-weight bearing is the best place to start. And Maybe ask them to bring and wear their runners in class for that added protective element of the foot and ankle. Proliferative stage. So this is our kind of middle stage. This is 10 to 21 days. This is like, we just had surgery, they just put the initial stitches in, they just put on like a starter Band-Aid, okay? We haven't got the really secure tissue down yet. This is just a mishmash of initial tissue, all right? Initial Band-Aids are on. It's weak to start. This is where we have fancy things happening called angiogenesis, which is just like new blood supply to the area, and fibroplasia, which is just, again, laying down new fibrous tissue. It's weaker, but it's starting to happen. Goals for this stage. We want to restore full range of motion, okay? We cannot go back into high impact, no running, no jumping, until we restore full range of motion. We want to decrease pain. Start with a low load, pain-free ideally with any exercises, but it's mobilizing and doing controlled movement, okay, to really get that motor control back. So not adding in speed just yet. And again, promote proper healing. Ideas for exercises. This is where we would start on maybe some TheraBand exercises, some gentle strengthening of all of the muscles in and around the ankle. You could start with some baby rises, okay, just to get that calf activated. Adding in intermediate balance exercises, such as balance flat foot, maybe with movement, so moving your other leg. You could do, again, small heel lifts. In dance, they can do bar work. They can do small rises. They can continue with all that core and hip stuff that they started on initially when they started, initially when they had their ankle sprain. Just caution with grand pliés. That's kind of a big range for a fresh ankle. Working on 2-foot exercises mainly, so no one-footed work yet. Mid-range demi-point, maybe halfway, maybe 3/4 of the way. No quick movements, no high impact, so no running, no jumping. And I include releves in this because they're kind of high impact, and no one leg work yet, okay? So no pirouettes or PKs, etc. Remodeling stage. So this is the later stage, 3 weeks to about, like I said, it can be up to and including a year. This is where we're getting that stronger tissue. Band-Aids are kind of useless, so we're wanting to promote that thicker tissue. So the weaker collagen, which is type 3, is being replaced by type 1. Not only that, but the fibers are going to start to realign or orient themselves along the line of stress. And this is where we have the SAID principle come into play. So it's specific adaptation to impose demand. So again, at this stage, we're starting to do more weight bearing, we're promoting proper mechanics of the ankle, and those tissues will start to respond to that type of demand. Most importantly, cannot stress enough, we want to strengthen and retrain balance and agility. Balance retraining, key with any ankle sprains. So in ligaments, there's little sensors, and they tell our brain where our foot is in space. As soon as we stretch or tear those ligaments, those sensors malfunction. They're not working anymore. And so we need to retrain them. And that is why you're at so much risk of re-rolling your ankle after a first sprain, because those sensors are malfunctioning. So your body actually doesn't know where your foot is in space, so you're more likely to kind of re-roll. And especially people with chronic ankle sprains, if they've had a sprain or an ankle that they always sprain, I question if they actually continued and rehabbed through all of these stages, or if as soon as the pain went away, they just went back to dance. So a lot of people with chronic ankle injuries, they usually didn't kind of complete that balance and agility piece that is key for rehabbing ankle sprains and ligaments. So ideas for exercises. More advanced strengthening, primarily in weight-bearing positions, a little more functional, especially for sport. More advanced balance exercises. So this is where we get to, once they've mastered balance on a rise on the ground, try a BOSU, try kind of a more wobbly support like a wobble board. Rotator discs are fun. So just challenging the balance a little bit more. Agility training, I'll use like an agility ladder. Again, starting small, maybe with like little quick steps in all directions, then progressing to small hops in all directions, gradually increasing speed and complexity. For dance, they can do all the bar work. Center floor, just ease into the big jumps, especially on one foot. So like grand jetés or controlling a big landing on one foot, that's pretty advanced, pretty hard, so I'm saving that for last. Start with small jumps on 2 feet and gradually progress like the magnitude of those jumps and then working into 1 foot the same way. Start with gentle releves and progress. And core and hip strengthening, again, should be continued. And then tap is really neat. So if they're a tapper, I find it's great rehab because it really is agility for the ankle. Start with chair tapping. Quick little movements, gentle weight-bearing position, and working up, but actually doing some tap exercises as a way to retrain those proprioceptors in those ligaments. So just note, one sprain does not match all. So just because I see one dancer with a lateral ankle sprain does not mean I'm going to treat it exactly the same as this other person with an ankle sprain. Please be cognizant of type and severity of the sprain. This will impact the healing time. So take those date ranges, take it with a grain of salt. It's going to depend on if they've had a history of sprains, will also impact healing time. And also, how are they dealing with the injury? Okay, how is the person that's attached to that ankle, how are they dealing with this? It can be quite scary if you've never had an injury before and all of a sudden you sprain your ankle and you have this pain. It can be quite traumatizing to some kids, so just notice as a teacher or somebody, if you're supporting somebody with coming back from a sprain, just notice how they're processing it, if they're getting really worked up about it or anxious. This will also impact their ability to return to full sport. Compliance with the program. I cannot do the strengthening for you. A personal trainer cannot strengthen for you. You need to take that on. So as much as, as teachers and as physios, we can be coaches, at the end of the day, if the student or the patient isn't doing their part, it's going to take longer and they're just not going to recover as quickly. So it is up to them to stick to their program and stick to the modifications, okay? Are they protecting the ankle initially? Okay, like I said, don't go off pain. Just because the pain goes away doesn't mean the integrity of the tissue is there and like we've honored all those stages of healing. So if they re-roll at 2 weeks, don't you know we're back to square one. So make sure they are protecting the ankle. We do not want them to re-roll as we're on this path to recovery. Respect the timelines or sacrifice how long it's going to take to get cleared to go back to full dance or for full sport. So I say to the kids, I know it sucks, you hate sitting out, but sacrifice now so that we can try to expedite this as much as we can given the stages of healing. Because if you do, go into jumps too soon or do re-roll it, we're back to square one, and that's more time off. So I kind of use that as an incentive to be like, I know it sucks now, but if we honor this now, we can kind of get back to what we love to do a little bit sooner, okay? So respect the timelines. If you're looking for ways to tape or specific exercises, use a SOAPBOX. That's what I'm here for. I know all of you don't have time to come see me or a health professional to ask questions or get treatment all of the time, but definitely seek somebody out. If you have had a sprain or trying to recover from one, make sure you get an assessment and get that coaching piece so that you know what to do exactly and when. And also so your teachers can get on board with that as well to help promote proper healing. So I hope that was helpful. Tune in with me each month. I'm going to try to do a different injury just to give you more knowledge on healing times and specific exercises and anatomy of certain injuries. But thank you so much. And if you are interested in any of the slides or the pictures that I've used, the reference is this Trail Guide to the Body book. Love it. It's a great resource if you're a student or as a dance teacher. Great basic anatomy book, and I've loved it for teaching as well. So it's a great resource if you're interested. Thanks, guys, and we'll see you soon.